ਬ੍ਰਿਟਿਸ਼ ਕੋਲੰਬੀਆ ਦੇ ਵਿੱਚ ਕੋਵਿਡ-19 ਦੇ ਮਰੀਜ਼ਾਂ ਦੀ ਗਿਣਤੀ ਇੱਕਦਮ ਕਾਫੀ ਜ਼ਿਆਦਾ ਵਧੀ ਹੈ। ਇਸ ਸਮੇਂ ਜਿਹੜੀ ਸੋਮਵਾਰ ਨੂੰ ਪ੍ਰੋਵਿੰਸ਼ੀਅਲ ਹੈਲਥ ਆਫਿਸਰ ਡਾਕਟਰ ਬੋਨੀ ਹੈਨਰੀ ਦੇ ਵੱਲੋਂ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਗਈ, ਉਸ ਮੁਤਾਬਕ ਵੀਕਐਂਡ ਦੇ ਉੱਤੇ ਹੀ 317 ਕੋਵਿਡ-19 ਦੇ ਨਵੇਂ ਮਾਮਲੇ ਸਾਹਮਣੇ ਆਏ ਨੇ। ਨਾ ਸਿਰਫ ਮਾਮਲੇ ਸਗੋਂ ਨਾਲ ਹੀ ਇਹ ਵੀ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਗਈ ਹੈ ਕਿ ਵੀਕਐਂਡ ਦੇ ਉੱਤੇ ਕੋਵਿਡ-19 ਦੇ ਕਰਕੇ 6 ਮੌਤਾਂ ਹੋਈਆਂ ਨੇ। ਇਸ ਦੌਰਾਨ ਅਧਿਕਾਰੀਆਂ ਦੇ ਵੱਲੋਂ ਇਹ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਗਈ ਕਿ ਸ਼ੁੱਕਰਵਾਰ ਤੋਂ ਲੈ ਕੇ ਸ਼ਨੀਵਾਰ ਦੀ ਦੁਪਹਿਰ ਤੱਕ 137 ਕੋਵਿਡ-19 ਦੇ ਮਰੀਜ਼ਾਂ ਦੀ ਗਿਣਤੀ ਸਾਹਮਣੇ ਆਈ ਤੇ ਫਿਰ ਸ਼ਨੀਵਾਰ ਤੋਂ ਐਤਵਾਰ ਤੱਕ 119 ਨਵੇਂ ਮਾਮਲੇ ਸਾਹਮਣੇ ਆਏ ਤੇ ਫਿਰ ਐਤਵਾਰ ਤੋਂ ਸੋਮਵਾਰ ਦੀ ਦੁਪਹਿਰ ਤੱਕ 61 ਨਵੇਂ ਮਾਮਲੇ ਸਾਹਮਣੇ ਆਏ। ਕੁੱਲ 317 ਮਾਮਲੇ ਸਾਹਮਣੇ ਆਏ ਨੇ। ਜਿਹੜੀਆਂ ਇਹ 6 ਮੌਤਾਂ ਹੋਈਆਂ ਨੇ ਉਹਨਾਂ ਸਾਰਿਆਂ ਦੀ ਉਮਰ ਜ਼ਿਆਦਾ ਸੀ। ਇਸ ਸੰਬੰਧੀ ਵੀ ਪੁਸ਼ਟੀ ਹੋਈ ਹੈ ਤੇ ਇਸ ਸਮੇਂ ਬ੍ਰਿਟਿਸ਼ ਕੋਲੰਬੀਆ ਦੇ ਵਿੱਚ ਐਕਟਿਵ ਕੇਸ ਕੋਵਿਡ-19 ਦੇ 1594 ਦੇ ਕਰੀਬ ਮੌਜੂਦ ਨੇ, ਜਿਨ੍ਹਾਂ ਦੇ ਵਿੱਚੋਂ 58 ਵਿਅਕਤੀ ਹਸਪਤਾਲ ਦੇ ਵਿੱਚ ਭਰਤੀ ਨੇ। ਇਸ ਦੇ ਨਾਲ ਹੀ 16 ਵਿਅਕਤੀ ਕ੍ਰਿਟੀਕਲ ਕੇਅਰ ਦੇ ਵਿੱਚ ਨੇ, ਯਾਨੀ ਕਿ ਉਹ ICU ਦੇ ਵਿੱਚ ਭਰਤੀ ਨੇ।
317 new cases, including 4 who were epidemiologically linked. Our total in British Columbia now stands at 7,279 people with COVID-19. And that includes 2,557 in the Vancouver coastal area, 3,754 people in the Fraser Health region, 195 people on the Vancouver Island Health region, 473 people in Interior Health region, 216 now in the Northern Health region, and 84 people who reside outside of Canada. We've now are up to 1,594 active cases in British Columbia in all health authorities, of whom 58 now are in hospital, 16 of whom are in critical care or ICU. Sadly, this past weekend, we've had 6 additional people die from COVID-19, bringing the total to 219 people. And again, 5 of the 6 people were elders in our long-term care system, 4 in the Fraser Health region, and 1 person in Vancouver Coastal Health. And we've had our first tragic death in the Northern Health area. Once again, our thoughts and our condolences go to the families, to the communities, the people who care for these loved ones who they've lost under these most difficult conditions. We now have 3,047 people who are under active public health monitoring and 5,446 people who have recovered. We have no new healthcare outbreaks, and in a bit of good news, we have 4 that are now declared over. The second outbreak at Holy Family Hospital is now declared over in the Vancouver Coastal Health region, and there are 3 in the Fraser Health region. The second outbreak that was detected at MSA Manor, one at the Sorney Alzheimer's Centre, and at the George Derby Centre are also all over now, leaving us with 13 active outbreaks in the healthcare system, and a total of 791 people affected, including 471 residents and 320 staff. We have no new community outbreaks, and the cluster that was associated with the Okanagan Correctional Facility has also been resolved and is now over. But there continues to be community exposure events that have happened in areas around the province, and I encourage people to continue to check health authority websites and the BC CDC website regularly. So COVID-19 has not left us, and it has required all of us to adjust our daily activities to ensure that we're doing what we need to do to keep those we are closest to and our communities safe. We must now all hold steady with our layers of protection and get ready for what we know lies ahead. We have to do our part and be ready for unexpected challenges like we are seeing right now with the wildfire smoke here that's impacting our communities across the province. I know how many people have questions about how to best protect themselves and their families when their air quality is compromised. And I want to encourage everybody, again, the information and resources about our wildfire smoke and your health is available on the BC CDC website. And we know that that there are important considerations, particularly for people who have underlying lung disease or asthma, heart disease, and diabetes. And we know that the mixture that we inhale with wildfire smoke has a number of particulates in it that cause irritation to the nose, to the throat, and to the lungs, and particularly affects people who are very young and our elders. And we know that they are the same people who can be most adversely affected from COVID-19. We know as well that pregnant women can be very affected by wildfire smoke. So those are the things we need to be concerned about right now. Outdoor exercise should be avoided right now until the sky's clear. As well, we know that mask wearing can help, if it's tight-fitting, can help as well in reducing the amount of inhaled particulates that we bring into our lungs. So that is something that people should be doing when they're outside right now.